Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. In the hospital, child life specialists help relieve anxiety and stress for kids and their parents. They're experts in using developmentally appropriate communication to help kids cope. I'm talking with Abby Loehrke and Rachel Stinson, two child life specialists from the Upstate Golisano Children's Hospital. Welcome to The Informed Patient, both of you.
Thank you for having us.
Thank you, Amber.
Is it normal for children to get anxious or scared of a doctor's or a dentist's office or a trip to the hospital?
Yes, definitely. I think just like adults, the fear of the unknown can be really difficult. And so sometimes when our kids don't know what to expect, or they've had experiences in the past that may have been difficult or painful at our doctor's offices, because sometimes there's things we have to do that are painful for kids to help them. It's really normal for them to sometimes have anxiety or fear surrounding coming to the hospital or coming to doctor's appointments or different medical experiences.
So what are babies trying to tell us if they get fussy in a medical setting? Are they picking up on that?
Yeah, babies can definitely sense when they are in a new environment, especially if, procedures are happening to them. They are painful for babies, and, caregivers are extremely important. Like caregiver presence is extremely important for babies. So when they get fussy, they may be reaching for their caregiver, but they also can sense that they're in a new environment. And if they're not near their caregiver, that could be a big reason as to why they're fussy.
I think the other thing with infants that we see is they really pick up on their caregiver's sense of calm or sense of stress. And so, especially our pre-verbal kids, they really are looking to their caregiver or their parent to set the tone. So the more calm the caregiver is or relaxed the caregiver is, the child is going to look and take that cue from them. Same with the opposite if they're really stressed or anxious.
So I was going to say, if parents are nervous about what's about to happen, the child is likely to pick up on that.
Absolutely. Yeah. And I think even as kids get older, they look to their trusted adult first to see what to expect. If mom is feeling nervous or dad is feeling nervous, then there must be something really big happening, and maybe I should feel nervous too. So we do see that a lot. And we, as child life specialists, really try to coach parents on how to support their child in those situations and how to find kind of their own calm so they can share that calm with their child as well.
What are some of the typical reactions you might see in toddlers or preschoolers when they come to a medical appointment?
So toddlers and preschoolers, that age is hard because developmentally they're aware that something's going on, but developmentally might not understand exactly what's going on, which is why having the caregivers there is important, providing some sort of medical play or preparation for that age is important because they can sense what's going on, and a very common reaction for them may be an upset behavior. And I don't know if you have any more to add to this, Rachel.
I think our toddlers, research actually shows us that that's our most at-risk group for like traumatization or long-term difficulties from hospitalization. They're the most at risk of our age groups that we see here at the hospital. So because they have a lot of magical thinking and they really can't think abstractly, they're very concrete thinkers. A lot of what we do here doesn't make sense to them, and they don't always have the verbal skills to tell us what they are feeling or what they need. So a lot of times, we are really just trying to meet them where they're at and do what we think to support them based on their development and what we know as child life specialists about development, and obviously using the caregivers as the best resource for that.
So as children get older, elementary school age or adolescence, does your job get harder working with them because they're even more aware of what's happening?
I think it's very child dependent. And so I'm sure if you ask any one of us child life specialists, we would all say we have a certain age group that we prefer to work with or that we like the best. So to say it gets harder might be a little bit of preference as well. But I think it gets harder in a lot of different ways. So when we're looking at our adolescent population, they're really starting to build that independence and that health literacy. And so they have different types of challenges where maybe they aren't always asking the questions that they have or expressing the fears or concerns that they have because they want to appear more adult-like or more independent. Or maybe we're assuming that they know more than they're letting on because they don't want to ask those questions or appear, uneducated or unaware. And then we also run into just with our teens and our adolescents, they're really seeking that privacy and independence. And our hospital offers very little privacy when you're a patient and a very little choice and control. And so I think with our teens, we see a lot of those types of challenges. With our school agers, I think, their challenges are similar in a way to their preschool population in that they have some understanding, but not a ton. But they also socially are starting to miss out on a lot of things if they're here in the hospital or if they are sick a lot or have a chronic illness. So socially, that's going to be really difficult for that age group. But as far as our job, I think the school agers start to get a little bit easier in some ways because we can really use a lot of teaching tools, a lot of visual aids, a lot of different coping strategies that our younger kids just don't have the cognitive ability to use yet.
Abby, do you ever see kids who are naturally just laid back and nothing ruffles them?
Oh, yeah. I mean, as Rachel kind of said, each kid is different. You never know what you're walking into. You may think, especially if you look at their age, you may be like, oh, perfect. I have a 17-year-old. They're going to cope really well. And then you go to meet them and they have like a needle phobia. So it just kind of depends. Like every kid is different. So a big part of our role is just when we go in, we are making an assessment. We are immediately assessing the patient, assessing what they know, assessing the family, and then kind of changing and deciding what sort of intervention that we want to do when working with that patient and their family.
This is Upstate's The Informed Patient Podcast. I'm your host, Amber Smith. I'm talking with Upstate Certified Child Life Specialists Rachel Stinson and Abby Loehrke. Is fear or nervousness around medical settings something a child will grow out of?
That's a tough question. I think it really depends on the type of support they have when they're dealing with those fears and concerns. So, we work really heavily with our oncology population, for example. And so they go through a lot in the beginning of their diagnosis. So they might get a port placed, they are learning about their future treatments, and we might see really poor coping happening during that time because there's so much unexpected. But if we can give them some tools and some support by telling them what's going to happen, what the expectation is, what it's going to feel like, talk about what would be helpful for them during those times, we see that confidence and that ability to complete what the healthcare team is needing them to do, even when it's hard, even when it's painful, and that compliance increase because they've had that support when things were hard, when things were scary. So certainly I think kids can outgrow it. And some of that comes from just development changing and development growing. But also I think who is there and who is providing support, whether that's the caregiver, nursing, physicians, child life, social work, whoever that might be, at those times of high stress. And if we can give them some coping tools and give them the opportunity to have emotional expression or process those experiences, we're going to see that not necessarily the fear decrease, but the ability to cope with the fear get better.
But you mentioned like the younger kids, if there's a really bad traumatic experience in a medical setting, that could, be something they remember into adulthood, and maybe it would make them reticent or uneasy coming back for medical care. But on the opposite, do you think that turning these medical visits into something positive, have you ever seen that would plant the seed in a child to pursue a career in medicine?
Oh, yeah. We see that all the time. I feel like we have a lot of patients who will say, like, I want to be a nurse when I grow up. I want to be a child life specialist. I want to be a doctor due to the positive experiences that they have. As child life specialists, we try our best to give them as much control over the situation. And that is why we use medical play, which is a way for kids to play outside of a procedure or any medical experience happening with the medical equipment, which a lot of kids have this positive experience with playing with the medical equipment, and we find that those positive experiences might lead them to a future in healthcare.
How would you like parents to prepare their children for upcoming medical appointments, whether it's a checkup or a blood draw or an x-ray? Do you have some advice that you'd like parents to have to help get their kids ready for the appointment?
Yeah. I mean, I think the first thing is being honest, but in a way that's developmentally appropriate. And so, what I mean by that is if a kid was going for vaccines at their doctor's and they ask you about that, am I going to get a shot at the doctor? Being honest with them about what's going to happen and then saying, but I will be there with you. And let's talk about what we're going to do during that to make it easier. Let's talk about where do you want to sit? What do you want to bring with you? How do you want to do you want me to hold your hand? Do you want to watch or look away? And so giving them some control and choice when possible, but also holding the firm boundary of this might be hard and this might be difficult, but it's something that's important that we have to do. So being honest, holding a clear boundary of where, what your expectations are as a caregiver or parent, but also then giving as much choice and control as possible because we can give them choices during those scenarios where it feels like they don't have a ton of choice. And that might be, do you want to take the medicine from a syringe or do you want to take a medicine from the cup? So really finding ways to give kids control before those appointments is helpful. But being honest, and then also when kids ask you and you don't know the answer, just say that you don't know the answer. And that's something that we can find out together, or why don't we ask the doctor when we get there or the nurse when we get there? But just kind of coming at things from a team approach. You and your child are a team and you're going to get through this together.
How far in advance do you think a child should know that they have a medical appointment?
So that's very dependent on age and development. Your younger kids, like toddlers, preschoolers, that younger age kids, they benefit from knowing a little bit closer to the time just due to their, they don't have a ton of sense of time or anything. So you might say, 3 days from now, but they don't really fully understand what 3 days from now is. The school age kids, we like to say a day or two, maybe you could probably do a little bit more. And then adolescents, definitely a couple days and allow them some more time to process it, give them some more time to provide preparation and ask questions and stuff. So it all depends on age and development for sure.
And some kids are very inquisitive. They may have 100 questions about what's about to happen, and some may not have any, right?
Yeah, absolutely. And I think sometimes we use a rule of thumb of like how many years you are is sometimes how many days ahead you should be told about something. So if you're 7, maybe we're going to tell you about a week in advance. And so that's kind of a rule, just a quick rule of thumb for parents as something to try to remember. How soon should I tell my child about this, especially once we get to the school age and older? But yeah, if we give them the opportunity to have those feelings ahead of time and then give them the opportunity to ask questions and process that, they're going to be a lot more prepared and compliant and aren't going to have that, necessary first fear because they've already had some time to think about what's going to happen and ask the questions that they had versus waiting until they get there and sort of surprising them with something that might be really difficult to hear.
Now, a lot of times adults, when they're preparing for an appointment, they may make a list of questions so they don't forget to ask something. At what age do you start coaching your child to be a little more responsible in their own health care? That's got to be when they're older, right?
Yeah, I mean, I think that's something we gear towards like the teens and adolescents, but I don't think there's any harm in kind of prompting them at a younger or maybe like later school age. So like 8 or 9, even if it's like prompting them to ask one question at their pediatrician or doctor's appointment, and kind of, slowly building up to getting them to ask more questions the older they get so they kind of can develop skills to advocate for themselves because when they're 18 they're technically adults. So what skills can we give them, or what skills can caregivers give them to when it comes to that time when they are adults, that they know to advocate for themselves and be more comfortable in asking these questions during their doctor's visits or any appointment.
I'm guessing that unplanned or emergency visits can provoke even more anxiety for both the parents and the kids. Any advice for how to approach a trip in an ambulance or a quick trip to the hospital?
Yeah, I mean, I think if you have the opportunity, bring a comfort item. And so that might be your favorite stuffed animal, a favorite blanket. I mean, that's not always possible, but sometimes that is a possibility, or having someone bring that. But again, I think just being as honest with your child as possible. So if you know something's about to happen, or asking the ambulance team, can you just tell my son or my daughter a little bit about what you're about to do? I think our medical professionals typically are really good at explaining or talking to kids about what's going to happen. And so just encouraging that and really helping to build that trust between the medical team and your child is really important. They're already so fearful. And so if we can come to them as, you and your caregiver team, but these medical professionals are also part of our team. And so it's not a us versus them, or they're having to do this really difficult thing to help your body, but we're actually all on the same team with the same goal of helping your body get healthy or get better or fix whatever's wrong. But just being, as much as you can, a calming force, a calming voice. And when you need to take that break to have those tears, or take that break to, whatever that might look like for you, it's important to take that time, because you can't hold it together all the time. We always say you can't pour from an empty cup. And so really making sure that you're also taking care of yourself during those really stressful moments, and asking for a break, asking for a child life specialist, if you're coming here to Upstate, but really looking for that support as much as possible for yourself too.
Is there any language that parents should avoid using during an emergency?
I mean, one thing we kind of talk about a lot as child life specialists, and this isn't necessarily geared towards parents, but we kind of say to the medical team, is trying to avoid medical language, just because it can be confusing for kids. Some kids, you might say, like, you're having to go get a CT scan, and they might not understand exactly what you mean by that. So just trying to break it down as much as possible, just to be honest with them, and try to use as much simple language as possible. Rachel, would you like to add to that?
I think that's great. And another resource that we have that we tell parents about, and would be a great resource for our families coming in an emergency situation, is on our website, on the Upstate Golisano Children's Hospital website. We actually have a bunch of preparation guides that the Child Life team has created. And so those guides have several different procedures. So IVs, T scans, MRIs, surgery, all different things that kids might experience. And part of why we did this was to be able to give parents and caregivers the tools to use when we aren't available, or when there isn't a child life specialist. Some of those look like social stories for our younger kids. So there's a bear and he's going to surgery, or he's getting an IV, and we go through all the steps, and it's actual pictures of our actual institution, so families can really kind of see what to expect. And then obviously those guides go to school age and our adolescent population too. So the language changes, and what we show them changes based on the developmental level that it's intended for. But that's a great resource that a parent could pull up on their phone, that they could pull up in the ambulance on the way. I can see that you're going to need stitches, so let's talk about what that's going to look like. Or we just found out you need an MRI. Let me pull this up, and we can listen to the sounds of what it's going to be like. And let me use this language that these child life specialists have said is appropriate for your development and helping you understand what's about to happen. So it's a really quick, easy resource that we send to families, and hope will be, we hope it will be really well utilized, because I think it really offers a lot of opportunity for families to do some of the work themselves before they even get here.
Is it helpful or not to have siblings there when the child is in the emergency department?
I think it can be really challenging for the caregiver when there's siblings, because it's very hard, as a mom with multiple children myself, it's hard to focus on them when you're just making dinner and supporting them. So when you're in an emergency situation and one of your children is sick or ill or injured, it can be really hard to split that focus. And one of your children obviously might need you a little bit more than the other at that time. So I think it really depends on the age of the sibling, the relationship between the patient and the sibling, but also thinking about the sibling's well-being too. And so if what is happening at the hospital is really traumatic or scary, and that caregiver is really focused on the patient, then sometimes that's where we as Child Life can help to come in too, and support that sibling and help them understand what's happening. Because just like the patient, they have a lot of questions and a lot of fear and sometimes misconceptions about what's happening to their sibling. So we as Child Life can sometimes help explain those things, or help foster a connection between the sibling and the patient if they're not able to be there. Is it ideal? Is it easier for the caregiver if the sibling isn't there? Of course, but we know in our hospital, we're a family-centered care facility, and that's just not the reality of having an emergency, that you always have somewhere for a sibling or another child to go. So I think, like anywhere, we kind of just make it work however we have to and support that family, meeting them where they are.
What do the child life specialists do in the hospital to help kids and parents stay calm?
I think a lot of it is just explaining to them what's happening. That question's a little bit loaded because I feel like it's all like very scenario based on things that we do to help patients and families stay calm. As I kind of stated before, we are assessing what's happening in that moment. But I also think day to day, we, especially if they're admitted in the children's hospital or they have a long stay in the emergency department, we will go check in on them. We offer a lot of resources, different things that maybe the patient and family can do in their room. We also have a family resource center on the 12th floor that they can go to. But as far as specific things we do to keep them calm, I think it's just being there to support them and kind of make sure they're informed on what's happening.
Does anyone who comes in with a child automatically hook up with a child life specialist, or do you have to be summoned by the care team, or how does that work?
It's a little bit of both. So we can self-refer to patients based on our own assessment of what's happening with the patient and family, or whatever scenario that they're coming to, why they're coming to the hospital. But we also get a lot of consults from our medical team. And so that can be from nursing, physicians, social work, chaplains. It can really be from anyone on the team that thinks child life would be helpful in those situations. And so unfortunately, we don't get to see every single child because there's more of them than there are of us. But, we really try to prioritize the kids who are at the highest risk for difficulties with hospitalization because of their diagnosis or their injury or the length of their hospitalization. So it really takes a lot of assessment and reprioritization, multiple times a day to make sure that we're getting to the kids that really need to see us the most. But certainly if a parent came in and really wanted child life services, they could always request that to their nurse or their doctor, whoever they're working with, and we would get that information and do our best to see that patient and family as well.
You're listening to Upstate's The Informed Patient podcast with your host, Amber Smith. My guests are Upstate certified child life specialists Rachel Stinson and Abby Loehrke. Well, let's talk about the coping strategies that you would like parents to know about to teach their kids or to absorb themselves. And I know that it's going to be different for infants versus toddlers and school age and teens and adolescents. But can you talk to me about visual guided imagery, for example? Do you use that, and how do you use that?
Yeah, Abby and I were talking about this actually a little bit ago because both of us work in an outpatient setting. And so often our procedures or time with patients is very short as far as how long they're here in the hospital. And we were talking about using visual guided imagery, and that neither of us have used it much since our internship days. But I do think I'm more likely to use something like the Calm app or a meditation guide or something a little bit shorter. One, because I think, if it's not something you do regularly, it's hard to practice if you're not something you're really doing on a daily basis. But two, it also gives families and kids a tool that they can use when they're not here in the hospital with us. So if we can find a really good meditative YouTube video that really seems to work for you, now you can use that when you're stressed before a test at school, when you're, have a big game and you need to calm your brain down or you need to just take some breaths. So whether that's guided breathing or guided imagery or meditation, it's not something that I think Abby and I use on a daily basis, but it's certainly a tool we've seen helpful for certain kids. And I think the key to using anything for coping is practicing it and using it when you don't need it. So really taking the time when we're not stressed or we're not overwhelmed to do that meditation, to work on our breathing, to whatever that looks like for that patient or family, but practicing those skills and those tools before we get into a situation where we need them, because it's really hard to learn those when we're stressed or overwhelmed.
Abby, do you see kids who are able to benefit from breathing exercises?
Yeah, we see a lot of kids who they might actually already have the coping tools they need and might already have a breathing exercise that they do at home. We see a lot of kids, I feel like we've heard of like the box breathing, or I feel like the parents will say, smell the flowers, blow out the candles, or a lot of them will be like, do the breathing like you do at school, or do the breathing that you do at home. So we do see a lot of kids coming in with already having some breathing techniques. And I know for us, like a lot of times during our preparation, especially if it's like, I'm going to give a blood draw and IV as an example. I know a lot of times during my preparation, I discuss different breathing techniques because that's a specific procedure that's important for them to take deep breaths because that helps get the IV in the right spot because the veins are better if, they're taking those deep breaths. And it also is a way to help calm their body. So a lot of times us as child life specialists will also kind of implement some breathing techniques in that preparation and even try to get them to practice before a procedure. So we do see a lot of kids utilize different type of breathing techniques during the procedure, and it might not work for all kids, but it is helpful for most.
How does distraction or diversion work? And do you use that often?
Yeah, I think just like any tool that we use, it really depends on the kid. And so, what distraction and diversion looks like for one kid might be looking or playing a game on our iPad or watching a show on our iPad. Where for some kids, they just want me to talk to them. And so, we might just be talking about regular day to day stuff. Tell me about where you go to school. Tell me about the video games you like. Tell me about whatever. And so, child life specialists are typically really good at talking about a lot of different topics in a lot of different ways. And so that's something that when we have students, we teach them distraction's a really powerful tool, but it's also a tool that is one tool of an entire tool bag. And so I think sometimes there's a misconception that all kids want distraction during a procedure or something difficult, whereas some kids really need to see that what we told them is going to happen is what's happening. And so I think sometimes as caregivers, we get worried about that. Oh, don't watch, don't look, don't look at that. It's going to be harder. But for some kids, that distraction is actually more distressing because what are you trying to distract me from, right? Why are you wanting me to not look at this, even though I was already told it was going to happen and I think I want to watch? So really trying to give kids again that choice and control to make those decisions. And then you can always go back to distraction if that's helpful for you. Certainly our younger kids, preschool, toddler, distraction is a great tool for them because cognitively they don't understand necessarily what we're saying versus what's happening to their bodies all the time. But for them, it's an awesome tool. Bubbles, light up wands, a book, a movie, a short game, playing I Spy in a room if you have nothing else, so you really can, we as child life have to become very creative sometimes because we only sometimes have our voice to use. And so maybe we're singing, we're counting is a great coping tool for a lot of kids. A distraction can be really helpful, but it's also just a part of the discussion of what do you want this to look like for you as the patient? What would be helpful for you?
Well, the profession of child life specialist sounds really like something a lot of people would be interested in doing. Can you just give us a quick little outlook on what it takes to become a child life specialist? What is your education like and how long does it take?
So some schools have undergraduate degrees where you get your bachelor's and you can major in like child and family studies with a concentration in child life. Other people will get their master's and have their undergrad and bachelor's be in some sort of human development or psychology. And there's some just other non-traditional ways, whether that is to get it online. But we have to complete a 600-hour internship, and then we have to sit for a certification exam to become a child life specialist after the schooling.
Well, very interesting. Well, I want to thank both of you for making time to tell us about your profession and to share some advice for parents of children. Thank you.
Thank you for having us.
Thanks, Amber.
My guests have been child life specialists Abby Loehrke and Rachel Stinson from the Upstate Golisano Children's Hospital. The Informed Patient is a podcast covering health, science, and medicine brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.